Welcome, everyone, and good evening. I wanted to first preface by saying I most commonly give this presentation chairside and usually runs half hour to 45 minutes chairside. I put a little more meat into this one because it's obviously a webinar, so I've got a lot of slide detail in here. But bear with me as I go through slide content and try to describe as best I can what I do chairside. Again, Jeff Price with ADEC, 24 years in the dental industry for 32 now, and prior to that was in the accounting and finance field. So right out of the gate, I've got a poll question for everyone. And the poll question is, how many of you are either currently or in the future or in the past have you experienced some sort of back, neck, or shoulder pain? Okay. Wow, higher than the average of what we see, and you'll see here in just a minute. So 90% of you, and I can assure you that those that answered no, you might just want to tune in to make sure that you're following procedures and protocol that'll keep you that way. So as we advance forward, ergonomics, really the root of it is ergon, which is work or labor, and then nomos are natural laws, basically the science of work. And if you take the dictionary definition, it's obviously a noun, but it's a study of people's efficiency in their work environment. And within dental, this has become a kind of a big topic over the last 10 years, maybe starting 15 years ago. Prior to that, there was not much focus on it. And quite honestly, dental schools have been very lax in teaching ergonomics. In fact, very few have any specific coursework on ergonomics. The challenge is that all of you as healthcare providers have a mission to access the oral cavity, and you will sacrifice your bodies to gain that access. And that often puts you in a compromised position, especially as trauma builds over the weeks, the months, and the years, as we'll take a look at. So OSHA cites a health risk of musculoskeletal disorders. They say upwards of 2/3 of practitioners practice in pain at the present time. I actually, when I was doing some more research early this morning, found a study that said up to 92% of dental professionals have experienced back, neck, or shoulder pain at some point during their career. That's a very high percentage. And that often results, obviously, in the areas that you can imagine, right? The back, neck, shoulder, and the forearm or the wrist, especially for hygienists. We'll take a look here that the recent statistics show that 67% of dentists are experiencing back, neck, or shoulder pain, 66% of assistants, and the highest category is always hygienists. Hygienists are 80%. But we're even seeing this in third-year dental students that get out and are already compromised or feeling the torture on their body. Here are the rate of occurrence that you see. So for dentists, the highest rate is in the cervical spine or the neck. That's the same with hygienists. The second rate for doctors are actually in their shoulder. And the third rate that you see of the most common occurrence is in the lower back with dentists. Hygienists, their number 2 rate outside of the number 1, which is obviously in the neck, is their elbow and their wrist. And their third is actually in their lower back area. And you can see the same detail with assistants. Their number 1 rate of occurrence is obviously lower back, as you can see. So what happens? You've got basically cumulative trauma that's building up because you're working in a static posture, you're in an awkward position, and you're repeating this. In fact, studies show, the hours that you calculate, you're sitting in that dental stool roughly 1,500 hours per year, and you're always sitting in that static position and that awkward posture. And if you're one of the lucky ones that, haven't experienced any pain just yet, you should know that MSDs are really predominantly due to accumulated trauma. So just like you see with your patients in dental disease, problems actually typically start underneath the surface. They start to boil to the surface slowly, and then they intensify with time, and then they break through to the surface. So this is why we try to capture this early. I do chuckle here because I often share this when I'm in front of a crowd, is that I share this often with my father used to tell me when I was lifting and helping him in the yard as a young man, and I would be lifting something heavy, and he would tell me, use your lower legs, use your body and your big muscles. And I'd scoff at him. I'd say, old man, who are you to tell me how to do this? I'm fine. Well, two herniated discs later, in my late 30s, early 40s, and I learned to listen to him. So I encourage all of you to, even though you aren't in pain now, the few who answered that aren't in pain, just practice properly, and will keep you from that pain long term. The challenge is your muscles contract and they strengthen on one side, and then on the opposite side of the body, they actually atrophy or become weakened. And so, as you can see in that skeleton image there, you become unbalanced, and that is no way to go through life in any profession, especially in dental. When we take a look at all these images that you see on the screen, most notably, every single image, you see the operator with a very large tilt in the neck over the body. So not only directly over the spine, but also twisted. Take a look at that bottom right image. That gentleman right there, I dare say that's a 90-degree bend between his cervical spine and his thorax spine down through the middle of his back. That's problematic long term. The image in the upper right and then also in the lower left show basically the chicken wing, where you're getting that elbow that's up above, equal or parallel with the shoulder, and certainly above the heart. That's a big no-no. We try to avoid that class of movement, and we'll talk about class of movement here in the next couple of slides. So what you're seeing here is basically neutral balanced position is what you want. The human body is designed the mid-sagittal plane to rest right there in that line that runs from the top of the skull all the way down to the bottom of the feet, and really runs right parallel with the spine. And you've got your knees over your ankles, you've got your hips directly over your knees, your spine is in alignment, and your head is straight up and down. That's what we're trying to accomplish there. Human equipment is designed to work together. And when properly aligned and used the right way, it works perfectly. When you look at this, you've got not only your spinal column that's so critical to every human being, but then the circulatory system, the skeletal system, muscular system, the nervous system, and all the organs work in conjunction. And when they're all working properly, all systems good. But as soon as you start to get that out of balance, you start to have issues. That's illustrated in this next slide. So most of you can probably relate to this. This is standard seating that you see on the left. And when I first entered the dental industry, you did not have seat pans that had a dynamic seat. So in other words, a seat that could tilt forward and take pressure off the femoral artery. The problem that you see the image on the left is that seat is actually cutting off blood flow to the femoral artery. And that starts to create all sorts of issues in the body itself. First, you'll notice it with feet that start to fall asleep on you. You'll develop varicose veins. You'll develop other circulatory issues throughout the body. And we used to teach, back when we didn't have seats that tilted forward, we used to teach that you would sit with your knees at 90 degrees. We no longer teach that. We now teach that you sit like you see on the right with a dynamic seat. You sit up taller, you tilt the seat forward, you open up the hips to about 105 degrees, which will also open up the knees to 105 degrees, and you sit in an athletic stance. So basically, if you were going to return serve, guard someone in basketball, i.e. the Knicks and Spurs are playing tonight, if you're going to play shortstop in baseball, you're in an athletic stance, you're on the coccyx bone and the balls of both your feet. Much better neutral balanced position right there. We take a look at this. Same doctor, improperly seated on the left, properly seated on the right. Notice the spine angle. So what you always try to accomplish in the human body and the physiology of the human body is an S-shaped curve to the spine. You can see to the left where that's poor posture, that's a C-shaped curve to the spine. And I will give you by personal experience. I had a C-shaped curve in the spine. I was driving the wrong car, sitting improperly in it in a low sedan. I'm a sick guy who's 6'4". I herniated two of my discs that way because the pressure kept pushing out. So I was 2 days away from surgery. Fortunately, I was able to forego surgery, but I ended up doing a lot of exercises that pulled my spine back into an S shape like you see on the right, and I recovered from that. But that's what we want to see in dental throughout your career is properly seated operator, both dentist, hygienist, and assistant that we'll talk about a little bit later. This is a big one. This is not only in dentistry, but this is now with the advent of smartphones. You're seeing this all the time. So people hold a phone out in front of them. You also have the oral cavity out in front of you. Those images that we saw a few slides ago, those 6 images where every one of the operators was excessively bent over trying to gain access into the oral cavity. The problem is for every inch that the head, and the head weighs on average 10 to 12 pounds, for every inch that it leans forward, it doubles in its weight. And you see to the far right, that's 60 pounds. That's what your head is when you're leaned forward at a 60-degree angle. And you hold that for a long period of time. Now, you don't feel that right away because your back muscles are compensating. So if you ever go home at the end of the day and you feel knots underneath your scapula in your back, that's because that's lactic acid that's built up from those muscles compensating to pull that weight and support that weight. So the more we can keep, again, the head in a neutral balanced position directly over the spine, the better off we are. That becomes challenging in dentistry, I give you that. But I think we're going to have some solutions for you that will help alleviate some of these problems. So the most important chair in the treatment room is the stool. It's not the patient chair. The patient chair is important because you need access to slide up underneath it. Patient needs to be comfortable. But again, you sit in that chair 1,504 hours per year. The patient sits in that patient chair on average a few hours per year at most. So the most important is that you've got a dental stool that gives you the support and the adjustments that you need to sit in a neutral balanced position. We talk about classes of movement, and this is going to be big as we talk throughout the remainder of the presentation. So you probably have learned these at one point. Pretty simple. Class 1 is simply the movement of a finger. Class 2 is your wrist and your hand together. Class 3 would be the elbow with no upper arm movement, just simply the elbow. Those are the 3 classes of movement that we want to see chairside. And we want to eliminate class 4 and 5. So class 4 movement is the elbow and the shoulder together. So again, the earlier picture where the gentleman had his elbow raised up at shoulder level, big no-no. We're trying to reduce that in dentistry. Also class 3, rotation of the trunk at the waist. You try to limit that in anything that you do. In any job role, whether it's dentistry, whether it's manufacturing, the more you can eliminate the rotation of the trunk at the waist, the better off you are, and then you're protecting that spine long term. Advice from OSHA is to evaluate and rearrange your work environment to lessen the damaging movement that is occurring to the body. Improve the positioning of the team for better ergonomics, and then stretching and physical fitness. That's a big one. And from their studies, work design is only 20% of it. It's really the worker habit. So a lot of this we can control through our own habits. Some of it's designed where you just, accessing the oral cavity, you can only perfect so much your access to the oral cavity, and then you're going to have to compromise your body to a degree. But if we can get in the habit of positioning that oral cavity properly, and well, we'll show you in the coming slides on how to do that with the use of properly positioning the patient, it makes a big difference. So let's look at 5 elements that can really change and enhance and give you better ergonomics in dentistry. So these are going to be 1, arrange your dental cockpit. And we'll take a look at that. Understand your equipment. Seat your patient correctly. This is probably the biggest one that I do in person. After I do it, I routinely have dentists that ask me to come back on an annual basis and do this presentation on seating the patient correctly. 4th is seat yourself correctly or stand. I'm a certified ergonomic assessment specialist. Went through training at the back school in Atlanta. And what they taught us is your next move is your best move. In other words, keep the body moving. I work in an office environment when I'm not on the road. When I do, I occasionally will have a stand-up desk. So I will sit for part of the time, I'll stand for part of the time. And suggest the same thing maybe in dentistry. Maybe occasionally, instead of seeing a patient in a seated position, maybe stand for one procedure throughout the morning, maybe a second one in the afternoon. And then finally, stretch. Stretching's key and critical, and we'll talk about those elements here in just a minute. So arrange your dental cockpit. Um, just like you see in the picture on the left, right? That's a pilot and a co-pilot. All their key tools, instruments, readings are right in front of them, closest to them, directly in front of them. The ones that are less significant, but still critical to the flight of the aircraft at times, would be up above them. And so dentistry is much the same way. As you look at the image on the right, it's creating the cockpit. And no offense to all the doctors who are on here, but the most important person right there to take care of is really the dental assistant, because studies show that about 85% of what goes into either your hands or the oral cavity starts at that rear work surface or that rear area of the treatment room, goes through the assistant's hands, and then either into your hands or the oral cavity. So the better we can equip that space to, again, store, dispense, and have readily available to go into the oral cavity, the better off we are. This is how many of you feel that you have a dental cockpit or your 12 o'clock area in your operatory set up for the greatest efficiency and productivity. I'd love to see who thinks they've got a good system back there. Okay, good. So it's about even 36% saying yes. And then roughly 64% that say either no or not sure. So that's good to know. So again, we call this, and I call this, the most valuable piece of real estate in your office. This is the most valuable piece of real estate in a dental office. This is what makes the office efficient and productive. And there's so many different small equipment items and medicaments that need to be stored, and not only stored, but then dispensed quickly. And the more that you can put in that 12 o'clock space and have at the assistant's disposal to go straight into your hands or into the oral cavity, the better off you are. When we look at this next slide, you see that then this is obviously is for a right-handed operator. So I apologize to the left-handed doctors who are on here, but you see the doctor's treatment area there where the right-handed doctor would sit. The assistant's treatment area is over obviously next to the doctor. Then working down towards the toe board of the chair, you've got the room cleanup on the assistant side. So that's where you'd have your sharps container. That's where you'd have a mount for your disinfectant wipes. You cross over to the other side of the room setup, where you'd have sleeves for the chair. You'd have your tray covers. You'd have sleeves for your light handles, syringe, maybe camera, any other items that you're going to sleeve. And then obviously all the way down, you've got your hand asepsis with your sink, and then more bulk storage on the other side. We try to encourage more, limited storage in the operatories where you can store and dispense there, and try not to have that assistant run up and down the hallway always to, a bulk storage area that's further down the hallway. You certainly need bulk storage, but if you can keep that in the room for at least the day, you create a more efficient team. You create a better ergonomic team, quite honestly, in that case as well. Integration. So the more that you can actually integrate and put within a short reach. So integration has come a long way with dental delivery systems. You've got the ability now to integrate, electric handpieces, scalers, intraoral cameras, even now the ability now to integrate implantology. So now you've got this true workflow integration. So everything's working off and right in front of you in terms of a delivery system. Everything's working off of the same foot control or rheostat that drives the handpieces. So very seamless. You don't have to go reaching for countertop surfaces that are elsewhere in the operatory, reach for a cart, make a twisting movement in the cabinet that's behind you. Everything's front and center. You can make all your adjustments front and center. This next screen shows you actually advanced endodontics that's capable with Apex location. So again, all your file systems are built in. You can simply plug and play, and you're ready to go and do a procedure. In this case, endodontic. In the previous slide, implantology procedure. So one delivery system, one control touchpad or control pad can provide for hygiene, can general restorative. Then you can do advanced endodontics with apex location or integrated implantology. Very, very strong and powerful to put that all at your fingertips. And again, reduce the class 4 and 5 movements in your operatory. Equipment connectivity. This is becoming very big now in the dental space, where you can actually connect dental delivery systems up through the network in the office, and they can communicate with the manufacturer. So it supports procedural workflow. So what I showed you before in those slides was integrated implantology, integrated apex location. Well, if you're just starting out and you're not doing implantology at this point, no need to incorporate that. But as soon as you want to take on implantology in the next couple of months, couple of years, you simply download the software, you add the implantology, the peristaltic pump, and you're off to the races. Same with endodontics, same with the intraoral camera, same with scaler, whether it's piezo scalers or Cavitron scalers. So it can grow with you. Your workflow can grow as you grow throughout your practice. It supports team communication. So now actually touchpads between rooms can talk to each other. So if I'm in a hygiene room and I want to send a note to the doctor in the treatment room, say, hey, patient's ready for exam, it sends that. So now I don't have to necessarily use, headsets. I don't have to use clunky kind of built into the wall communication systems or try to run it through my screen, my monitor screen. I can actually have it right there on the touchpad in each and every room. You can manage multiple operators now as well. So what's really nice is you can walk into any of the rooms and you can have settings for multiple doctors. So if you've got 3 doctors in a large practice, each one of them can have their own settings. In fact, some systems you can manage up to 99 operators. So think about dental school or very large group practices. You can manage the equipment as well. So again, the equipment can grow with you, that ancillary device expansion, you add it when you're ready. But it's nice because now you've got a platform that just kind of grows with you, and you put those tools right in front of you that are ergonomic to the way you practice and the patient care you want to deliver. And then finally, proactive servicing. This is powerful. This is when a manufacturer can reach out to you as the operator and say, hey, we're noticing that in Operatory 2, the handpiece is running a little hot. Your electric handpiece might be something to take a look at. So not only is this in the operatory equipment room, this is now actually in mechanical room equipment as well, the heart and lungs of the office. So just something to watch as that progresses through these upcoming years. Technology-assisted ergonomics. When we talk about this, one of the beauties is, when you are connected like that, and you can actually then take your settings with you. So once you set up everything in one room, you can have all your chair presets, you can have your electric presets, endodontic file settings, implantology settings, and then you go to your second room and they display and they operate identically to what they did in room 1. You could even, if you have multiple offices, you go to your second or third office, you pull up your name, and then boom, it downloads all that. So again, very consistent experience in where you're bringing the patient back to and how you're practicing ergonomically with that patient, not only in how they're positioned, but how your equipment in front of you on the delivery system is going to deliver to you without that class 4 and 5 motion. Again, just another slide on that access to personal settings for each and every operator. So number 2 is understand your equipment features. This is a big one. I've been doing this long enough now that I would say the most powerful tool, okay, we talk about the most powerful chair in the treatment room is the dental chair, but the most powerful tool in the operatory is actually a double articulating headrest. That headrest gives you a lot of power to manipulate the patient's head, which we're going to see in point number 3 coming up here in just a minute. But make sure that you follow the manufacturer's instructions and online training tools that are out there to understand exactly how to maximize and get the most efficiency and effectiveness out of your equipment so that it serves you well, positions you well, and supports you into a long and lengthy career. So this is the one I told you I get asked back repeatedly to cover. Um, this is big. If you take a look at that headrest is set properly. And your next slide, you'll see one that's set improperly. But what we like to see is a patient sitting tall in the chair, all the way back against the backrest. And we like to see that headrest articulated out. So it's supporting the cervical spine. And it's basically a catcher's mitt for the occipital arch or the occipital bone in the back of the skull. And that's giving really good support to the patient. It's also pulling the patient further up the chair. I typically go into most offices, dental schools, you name it, VA clinics. That headrest has no articulation forward on it. And that bayonet bar, that silver bar that you see, is pushed all the way down into the chair. And so what it promotes is what you'll see in this next picture. If you look at the image on the left, that is a poorly positioned patient because A, the headrest is slid all the way down. B, she's slid down because she's targeting the headrest. If you take a look at the gap here, that's behind her lower back, right? We want the S-shaped spine. So she's getting no support there where we want the S shape of the spine. And again, there's no articulation here supporting her cervical spine. Now, conversely, the patient on the right has been seated properly. Look at how much taller she's sitting in the chair. Look how she's supported by that headrest cushion. Look how there's no gap at all back here by her lower lumbar area. And then the final point to note, and this is a dead giveaway, look at the feet and how close they are to the water bottle here versus the feet on this woman and how far away they are from the water bottle here. I can tell you that if you sit in a chair, a radius chair with a water bottle, if you're seated, if you've got a patient seated correctly, up until a patient is 6'6" or taller, they should not have to lift their feet so that you can rotate that arm around. If you have to with shorter patients, the patient isn't seated far enough back in the chair. And the difference this makes is when you take them back, you can actually now really articulate that headrest. So if you see the mandible arch and you're working on the left, right? So now I can have a flat plane. I can get that chin down to the chest. And in the second image, I can go ahead and push that bayonet bar up. I can tilt that up and I can get access to the maxillary arch pointing up, basically kind of perpendicular with the floor. That's what we want to see. That's what good patient positioning will lead to. That allows you to access the oral cavity with less lean and slumping and lifting of the shoulder and the elbow to access and do work in the oral cavity. In essence, instead of you contorting to get to the oral cavity, you bring that oral cavity to you with use of the double articulating headrest. This is what we'd want in a perfect world, right? Practice dentistry pain-free, patients floating there, doctors up underneath there, at 12 o'clock position, arms slightly above about heart height and working perfectly. No interference with the chair and a patient that's very comfortable, but a practitioner that's practicing in an excellent position, neutral balanced position. We take a look, that's what we're trying to achieve with the dental chair is just what I showed you in that last slide in this slide here. And then fourth, from an economic or ergonomic standpoint, your dental stool, we've talked about, it's the most important chair. It's really important to your musculoskeletal health. So we encourage you to test drive multiple stools, find the one that's right for you, but find the one that's got the tilt on that seat pan, that dynamic seat that'll put you in a good athletic stance and good positioning. When we take a look here, again, as we touched on before, out is the old way where we sat at like 90-degree angle with our knees. In is where we sit higher. We tilt the seat down. We're in an athletic position and we open the hips and the knees to about 105 degrees. And you get really good blood flow at that point, and you're in a good neutral balanced position again at that point. From an assistant standpoint, really important. We see most of them using that belly bar, we call it, the torso bar. That's simply a belly bar, and they put both elbows on it and they lean up over the patient. We prefer to see knees kind of facing more to the 12 o'clock area in the operatory. put that torso bar just underneath the lowest rib, and then lean into that torso bar. And that will give you much better support in that position. And also, typically, you want to be sitting the assistant 4 to 6 inches higher than the doctor for better visibility down into the oral cavity. And then five, last point here on ergonomics, you want to prepare your body for the rigors of dentistry. And I'm going to share a couple of stretches here with you, and I've got handouts that will be shared with you after this too. And this was really alerted to me and highlighted to me back when I first started consulting on ergonomics. At the time, neither of my boys were driving yet. They were both into sports, playing football. My youngest played lacrosse, and anytime we had an away game, my wife and I would have to pile in the car with, one or two of our boys. We'd go drop our son off for lacrosse practice, and we would typically, because I live in Arizona, so we would go find a Starbucks or something to go kill an hour's worth of time. And it dawned on me, well, gosh, that hour's worth of time, what is Jason doing? Well, you know what all those athletes are doing is they're at the field, and what are they doing? They're stretching, they're doing calisthenics. They're getting their major muscles, their large muscles, ready for the job. And so when it comes to game time, they're less prone to injury because they've got blood flowing through their body. So I didn't put this as a poll question, but I guarantee 100% of you are going to say, hey, at the beginning of every day, you and your staff go through 10 to 15 minutes of preparing for your day. You're doing stretches. You're getting blood flow into all those major organs, all those major muscle groups. I say that in jest because just about every time I ask that question, the answer is no. So, but you think about it, it's very important because of the rigors of what you do, those static postures, that you should be doing some sort of form of exercise. Yoga probably being the best, but I'm going to share with you some stretches. And again, these will be shared with you afterwards. So I'm not going to go through them in too much detail, but there's 5 of them here. The first 2 happen to deal with the finger and wrist flexor extension. And this is for more carpal tunnel, right? And basically you're pulling or you're putting opposite force on what you're typically using in dentistry. So you're trying to reverse the effect and the buildup of what you've done in that operatory during that day. So here's a finger and wrist flexor stretch. There's a second one here, just basically getting a twist in a different direction. And again, that's restoring both your fingers and your wrist in that area. Hamstring stretch. This is an important one. This is one that you can do in the office because you're standing up and you don't have to get down on the floor to do this. But many people don't realize how important the hamstring is and that muscle is to your lower back health. In fact, a lot of doctors will tell you, neurosurgeons will tell you that's the first place to focus on, stretching hamstrings to try to avoid lower back pain or get rid of lower back pain. So very important stretch there. The lower back flexor stretch is basically you're just trying to take a C-shaped spine and lean back and create an S shape. So the more you can do that, and again, undo and unwind what you've been doing in the operatories by leaning forward and gaining access to the oral cavity. And then finally, this is a great stretch. We talked earlier about, the cell phone, and they call it tech neck, right? So not only do dentists have it because dentists are leaning over and trying to access the oral cavity, but we all have smartphones and we're looking at them almost all day long during our free time. So the neck tends to lean forward. So this neck shoulder stretch is good to kind of pull that back and get rid of the lactic acid that's built up in your upper back. I've got a bonus for you here. Our final couple of slides are going to deal with clinical illumination. And the reason why I share this is back, neck, and shoulder pain is the number 1 problem for the dental profession. Eye fatigue at the end of the day is number 2. And I'm going to share with you, and I'm going to go ahead and skip over the loops comment just because I don't want to stall out again. But I want to introduce you to this gentleman, BJ Chang. This gentleman actually is the president and chief scientist at Surgitel Systems. He still is today. He's been there for a long time. But back from the late 70s through the late 80s, he was instrumental in developing heads-up displays in fighter jets. And he brought that into basically dentistry and through lighted loops. So he runs a lighted loop company. He's the chief scientist there and the president. And he's a big believer, as we are, of lighted loops. Now I'm gonna share with you. I'm gonna read something here. It's the only time I'm gonna read off screen, but because this comes right out of, and you'll see references here at the end of the presentation, but this comes right out of his white paper. Studies show that to achieve the best visual comfort, we should maintain a proper target to background brightness ratio. The target to background ratio compares the brightness of our target or work area, oral cavity, compares that to the surrounding work area, basically the rest of the face. This ratio affects the visual acuity and comfort of the eyes. A ratio of 3 to 1 is recommended for the best visibility and eye comfort. This is important. I'm going to share this. So you see light sources in dentistry. You've got the ambient light, which is up to 1,000 lux. So lux is simply the measurement of light reflecting off of a surface. You've got the dental light, which can be up to 30,000 lux in a high setting. You've got a headlamp, so lighted loops. Lighted loops are very important, and they keep you in a good ergonomic position, but that headlamp alone can be up to 90,000 lux, very intense light. A fiber optic handpiece can be up to 25,000 lux. Why is this important? I'm going to share this in just a minute. We notice that there's a lot of people out there, and as does Dr. Chang, that are using simply lighted loops without an overhead light. And that damages your eyes long term. So when you look at the target on the left, if you've got a 90,000 lux that's into the oral cavity, right on the face, right around it, you basically want 30,000 lux, and that way you maintain a 3 to 1 ratio. If you see on the next slide and you look to the far right, if over there all you have is your overhead LED lights casting 1,000 lux onto a surface, and then you've got a 90,000 headlamp pointed into the oral cavity, that's a 90 to 1 ratio. That is very damaging long-term on the eyes, and Dr. Chang's white paper shares that detail. When you have an overhead light with no lamp, you still have high ratios, higher than you want. But when you use a dental light to the far right in conjunction with lighted loops, you can achieve that 3 to 1. And again, it reduces that eye fatigue at the end of the day. It protects the retina and the cornea of the eye and provides for long-term visual health in each operator. So these are the resources that I pulled much of this from. Again, this is a topic that has been near and dear to my heart, and I've been consulting on for probably 15 years. Typically, it's chairside. Very rarely do I do it in this format, but I was very honored to be able to do it in this format. Next slide, I've got my contact information that's here. You see the picture of a very well positioned doctor sitting high. Again, seat articulated down, hands at heart level, really good ergonomic position there. But back to my contact information, if you've got any questions for me, I would encourage you to reach out to me here at jeffprice@adec.com. Be glad to field those questions. And then at this point, we'll open it up for any questions that have come through the chat.
So the first question we have is, are inversion boards helpful? I've been in so much pain that I'm willing to try it and was curious if you had any experience with this.
So I'm assuming the inversion board is one that you flip upside down and it basically decompresses your spine. If that's the case, I will tell you from personal experience, I had a tough time using those. What I did when I had my herniated disc, I actually found a chiropractor had kind of an old school machine that would put a harness around your hips and a harness up just underneath your shoulder. And as it's on a table, it pulled your spine apart. So it just articulated that spine over about a 10-minute period. And what it was doing was decompressing the spine, the same thing that those tables do. I think the problem is that inversion table what I notice and what I've talked to chiropractors is they feel you have a tendency to tense up your core muscles because you don't feel comfortable laying upside down. So I would encourage you to maybe go the chiropractor route first for decompression and look to go that route. And I'm not a doctor, so yeah, I'm only giving you my advice on my personal experience.
Why would the doctor's hands be near his or her heart while prepping? What about 90 degrees at the elbow?
So not sure if yeah, so that's well, and that's what we're trying to prevent is, and I don't know if you can see me on the screen, but we're trying to prevent this chicken wing. And that's what you get when you get compromised patients or a compromised position of patient, and you don't get them properly seated. Now all of a sudden you're taking your body and you're sacrificing your body to get in and get access, visual access to that oral cavity. So if you can't bring that oral cavity back to you using a headrest, now you're coming up over the oral cavity. You're lifting your arm to maybe get access with a handpiece or a hand instrument. And that's a big no-no. We want to bring the patient back supine and then use the double articulating headrest to bring the patient and the head, again, the oral cavity to the team instead of the team moving to the oral cavity. I know in theory it sounds great and it's not always easy to accomplish, but we can certainly do a better job than what we have through the years is using that double articulating headrest.
What are the mechanics for eye damage with differing light intensity?
So the mechanics, I would encourage you. So what they say is the balanced light. So when you've got a more intense light, it puts more damage because the retina opens up larger, and you've got more possibility for damage internally in the eye. And that's why they say it's very important to have balanced lighting. And again, loops are great because loops are typically obviously magnifying, and lighted loops even better because they give you a good illumination. But if you got them turned up so high and you don't have any other type of light source, can be damaging. One thing, if you're not going to work with the dental light, I suggest you take the loops and you turn the intensity of the loops down so that they aren't as damaging on the eye. Most loops do have an adjustment where you can sliding scale adjust those. But still, you're not going to get to a 3-to-1 ratio, but certainly don't work at a 90-to-1 ratio.
How do you feel about the saddle seat for the operator?
So I'm a proponent of saddle seats. Saddle seats are good. My only downside with them, they position you properly, they sit you upright, they tend to be aggressive. So some people don't like them because they're a little too aggressive of a saddle. And then most of them don't have a backrest. What I like to see is if you take a look at the gentleman who's sitting in this picture, that sits like a saddle stool, not as aggressive. And then it's got a backrest that'll come up to it to the small of the back. And by pressing on the small of the back, it's just a reminder, hey, sit up straight, keep my S-shaped curve to my spine. So, but yeah, while I'm not the biggest proponent, I think it's better than some of just the round dome stools that I still see dentists sitting on that just aren't doing them any good from an ergonomic standpoint.
Any tips for chicken wing, arm, elbow when doing a cleaning? I find my arm lifts to retract the cheek or not lay on the patient's face.
Yeah, and that's one of the toughest, and that's why when you saw hygienists have the highest rate of musculoskeletal disorders. Um, Hard to get around it because they've got to work the entire oral cavity. But one of the things that you can do is really two things. One is articulation of the headrest. So if you are working the maxillary arch, if you can get the chin up on the patient, and depending upon what side of the arch that you're working on, actually have them. So, say I'm on a lingual surface, a number 3, and I'm a right-handed operator, go ahead and have the patient actually look towards you or tilt their head towards you so you get better visual access. So if a hygienist, I can work, those surfaces, the lingual surfaces, and then I can have the patient look away, right, to work the opposite surface. So Very important to try to use that and again, manipulate the oral cavity to come to you instead of you going to the oral cavity all the time. It is a tough one for hygienists. I get it.
How about the many patients who refuse to be laid back? Ends up where we have to stand on our heads to treat them.
So yeah, so that's always a tough one. When I'm doing this in person, I slap the back of the chair and I say, Mr. Price, for your comfort, scoot all the way back. And I teach the dental team to have that patient sit back long, tall, right? Get the headrest up to them. And then I basically coach the doctor to say, Mr. Price, if you allow, I'm going to bring you back, maybe back a little further than what you typically like, but I'm going to use this headrest to adjust you to get the oral cavity to where we as a team can work on this most efficiently and effectively and we can get you through this procedure quicker. Are you agreeable to that? And I think most patients will be if you get their buy-in, say, yeah, I'm agreeable to that if you can make this go faster for me. Some patients, my mom's one of them, elderly, she's got a gag reflex. She just doesn't like to go all the way supine in a chair. And that's the time where you compromise and you're going to have to contort your body to a degree. But if you can get buy-in from your patient on the front side, and say, yeah, I'm in agreement with you, doctor, to you and your team, go ahead and do what you have to do, and I'll stomach myself through it.
I think you answered this question already, but just maybe if someone wants a little clarity. What if you work with the chair headlight and do not use loops light for work?
Yeah, if you don't use loops, that's fine. That's been dentistry throughout, right? So a chair light is typically at a low setting. A dental light's going to have about 15,000 lux. On the high setting, up to 30,000 lux. So even if you worked with it on low, 15,000 to your 1,000 lux in your general lighting, that's a 15 to 1 ratio. That's not as bad as a 90 to 1. The reason why we like, and again, I'm with ADEC. We don't sell loops, so I've got no skin in the game on this. I do think that loops put you in a good ergonomic position, and they kind of force you to maintain an upright posture. Because if you start to, you know, sag in and get close to the oral cavity, you're going to lose your focus. So they force you to stay back in a good working position. You even see loops now that have 90-degree turn to them. So you can literally do heads up dentistry where you're looking forward and the angulation of the loops is down 90 degrees into the oral cavity. So I think those would be tough to get used to at first, but boy, you talk about a good ergonomic system. That's a pretty good system.
When I uh, when I use high magnification loops, I don't see the surrounding areas outside the mouth. So why does it matter if there's a more gentle light outside of my viewing area?
So I'd have to understand your loops. And again, I can only defer to Dr. Chang, who runs Surgitel, and he's a lighting scientist, and it was his white paper. If you look, and I don't know, Dr. Khan, if we can get those resources I put in there, that white paper, and for anyone who's interested, I have it on my laptop. I've got it on file. I'd be glad to send that to anyone. It's written by him. It's actually on their website too. But I'd be glad to send it so you can study. I've got one that's highlighted, so it's a Cliff Notes version. All the text is there, but the highlights are the important things in it. It's a good, if you want something to put you to sleep at night, it's a good document to read. But I'd be glad to share that. And again, not an expert in that specific area.
Any help with lower back pain, position, or exercises?
Yeah, those exercises that I showed you, number one would be the stretching of your hamstring would be first and foremost. Number two is the back bend stretch where you're basically bending backwards. And then anything that you can do to strengthen your core. Again, personal experience, two herniated discs that I dealt with for a couple of years before I got past. And it was all about strengthening the core muscles. When you don't have an S-shaped curve to your spine, you sag, and what happens is the material between your vertebrae starts to push out your vertebrae when you C shape, and it continues to push out until eventually it pushes out so far it's pushing on the nerve. And you've got to reverse that trend. And really, the way to do it is stretching hamstrings, strengthening the core muscles, throughout your abdomen.
Are you familiar with McGill's Big Three back exercises? And if so, what do you think of them? And are there other body weight exercises you would recommend to strengthen the back? I heard you mention yoga.
Yeah, I'm sorry, I'm not. I've heard that term, but I'm not familiar. I don't know enough about that at all. I am a big proponent. I don't do yoga myself. My wife tells me all the time I should. Um, but I will tell I do other exercises to kind of keep my core strength. But I will tell you that yoga to me is probably the number one. But number two is just doing a good routine of strength exercises for your core, doing those at least 3 times a week. And again, using those stretches that I know, Dr. Khan, you're going to distribute after this session. But you'll see these in form. Post them in the break room and encourage your staff to do them. But just by starting to do those, once maybe in the morning, once at lunch, once mid-afternoon, I think you'll start to see some results even after just a few days, if not a few weeks.
What if some old patients cannot physically go back?
Yeah, kind of like we talked about before. If they can't, my mom was is one that just can't be laid back all the way. You're going to have to, for that particular patient, you're going to have to compromise yourself to a degree. The key is, if 90% of your patient base you can bring back to a full supine, get their agreement and buy-in to use that articulating headrest to position them properly to get them through maybe more quickly. Um, and then for the 10%, the 5 or 10% that can't, that's when you compromise your body just in that case. But by all means, don't compromise your body for 100% of your patient base. That's what gets us into trouble.
I use ADEC equipment and I find that my back usually does not touch the back of the chair. Should I readjust?
Yeah, so it sounds like on the stool. So yeah, and so ADEC makes two levels of stools. Our newest stool is the 500 stool that you can see there in that picture. It's got a lot more travel to that back that will come up much further than our old 400 stool that's been around since 1998. Sad that I know that, but I do. Um, and the other thing I would encourage you to do is, every single ADEC rep around North America is certified CEAS, and I go out frequently and do trainings like this chairside, at lunchtime. And trust me, it's not a sales pitch. We're not selling anything. We're trying to get providers into better health. And it's all about education. And even when they can come out, they can give a credit a CE, even when they do it hands-on. And so I would encourage you maybe to get your ADEC person out, representative out, just to take a look at the stool and try to position you better in that stool.
Well, that's a perfect segue to our last question. Where can we find an ergonomic specialist to come to our office? Is there a certification to look for?
Ah, that's perfect. Yeah. So I can't speak to any of the other manufacturers. I know ADEC took this on probably 12, 13 years ago as we made a dedication and investment in every single person that we had at the time. Every new hire goes through it as well, goes through the back school in Atlanta, Georgia, and we get certified for certified ergonomic assessment specialist. They specialize they basically specialize in all workplaces, but then they developed a program that was specific to dental. And so we feel very confident that we can go out there and make a difference. Um, you're never going to get perfect. I mean, it's challenging. That oral cavity is a pretty small oral cavity, and trying to get there and work in that. And you've got your fingers, handpiece, mouth mirror, instrument, suction coming in, assistant trying to get access. It's a challenging spot, but we're trying to do the best we can to help enhance what we can do for each and every one of you.